Long queues for ambulances, not enough staff, beds or appointments. All well-documented pressures on our health system that are pushing it to breaking point. While hospitals are struggling to cope with the number of patients coming through the doors, GP surgeries, often the first port of call for many, are also battling with bursting patient lists and a lack of staff.
We're providing more appointments than ever before, and we've got fewer GPs than ever before. And I think the stress that people are under is causing people to leave, to retire early. Young doctors aren't choosing to be GPs, and so this real sort of fundamental underpinning of the NHS is really in danger.
And it's because of these problems that a group of charities are warning today that the system has reached crunch point since the pandemic. And without more funding, it'll soon be completely unable to respond to the population's needs.
The twin shocks of the pandemic and now the cost of living crisis have really impacted on not only the health of people with long-term conditions, but also the system's ability to meet their needs. You can't fix the health system without addressing social care funding. And by the looks of it, the government has kicked addressing the problem of social care down. They've kicked that can down the road.
And more funding is what's needed at this care home in Kent. The owner says it would help with the rising cost of overheads and would help recruit and retain more staff.
Thank you very much.
We're only a small care home with 22 beds, but the challenges are really quite huge. We face pressures on staffing, we face pressures on costs as well, we face pressures on recruitment, so multiple pressures we're facing at the moment just to keep going as well.
The government says it's investing billions of pounds in the health and social care sector, but those who work within it say that investment is needed right now. Without it, the situation will get much worse.